Hello everyone and welcome to IVF Australia's first webinar. My name is Jen Cox and I work on the IVF Australia information line, and I wanted to thank you tonight for welcoming us into your homes. I know we're reaching quite a few of you in the remote areas of New South Wales, so we welcome you tonight as well. I wanted to introduce you to Dr Raewyn Tierney, who's going to be giving the presentation tonight. We're lucky to have Raewyn tonight. She's one of our very popular IVF Australia specialists. She has got a wealth of experience, 15 years plus in gynecology and reproductive medicine. She's also a reproductive endocrinologist. She consults out of our Maroubra branch at IVF Australia and also at the St George Private Hospital. And like many of our doctors at IVF Australia, where you consult with your doctor doesn't necessarily dictate where you go for treatment. We have a very flexible arrangement here with us where we make it as easy as possible for you to receive your treatment. Now, I'm going to be coming back to you a bit later tonight, but I'd like to now pass over to Dr. Tierney, who's going to start the presentation. Thank you.
Great, thanks Jenny. Thank you very much, guys, and welcome to our first webinar tonight. Now, as Jenny said, we're all here to discuss the most important thing, which is the creation of a human life. And I know some of you listening tonight are only in the early stages of thinking about getting pregnant, and some of you may be in sort of advanced stage of thinking and been trying to conceive for some time, and would like to know further about what options are available. You might feel a bit confused, or you might even sort of be a little bit worried, or you might even be a bit excited. But wherever you are on your journey, we hope that tonight, that this webinar will hopefully answer some of your questions and also give you some of the options that are available to help you conceive. So in this webinar tonight, you will be learning firstly, preconception tips and how to improve your fertility, what the chances are of conceiving naturally, and what some of the fertility options are that are available that will help you conceive. So let's get started, Jen.
I'll just get this started so you can all see what we're seeing. So just bear with us a minute.
Great.
And there we go.
All right. So we're starting with fertility advice from the expert, which is me. And as I said, in this webinar tonight, we'll be talking about tips about getting healthy for fertility and the chances of conceiving. Now, let's go to the next slide. Thank you. Great, thanks Jenny. Now look, if you're trying to conceive, the most important thing is really preparation, and preparation is important. By being in the best health, that will help optimize your chances of getting pregnant and staying pregnant. Now it's very important to make sure you're eating a healthy and nutrient-rich balanced diet and containing fruit and veggies and lean protein. Try and cut out the fats and trans fats from fried foods. It's very important to be a healthy weight, because we know that weight will affect your fertility. And one of the simplest ways for you to measure your weight is a measure called body mass index, or BMI for short. And the ideal body mass index is a measure between 18.5 and 25, and you can get on to Google to work how to do that. But it's very important because studies have shown that it's far more difficult to conceive if your BMI is greater than 25. But don't panic, because there is good news, and studies do show and demonstrate that you only have to lose 5 to 10% of your weight. And by doing that, that can improve your fertility, help ovulation, etc. While you're trying to conceive, it's important to start a vitamin supplement that contains folic acid and iodine. And folic acid is important for reducing the risk of a neural tube defect like spina bifida, and iodine will help with thyroid health, which will encourage a healthy pregnancy as well. And if you're smoking, it's very important to stop smoking, because multiple studies have shown that smoking will have a detrimental health on your reproduction. And by the way, look, good time to review your alcohol consumption. You can still drink, but it's only really in very moderate amounts. And when I'm talking about moderate, I mean 1 glass a day. It's important not to binge with alcohol, and binging is defined as more than 5 glasses in any one session. So this is a great time to really look at your overall health. In terms of coffee, well, you can have coffee. You sort of live life and do all your daily things, and coffee is fine. However, you must drink it in moderation. It's recommended perhaps no more than 2 or 3 cups of coffee a day. Now, many of my patients do ask me, Raewyn, does stress affect my fertility, and will it stop me from conceiving? It's a very common question. In fact, the answer is there is no research yet to suggest that to be the case. However, stress is important because when you're stressful, you're most likely to consume poor food, drink more alcohol, perhaps smoke. You're more tired, so you're less likely to have sex. And if you're not having sex, well, you're unlikely to increase your chances of conceiving. So certainly stress can impact that way. And finally, I want to just have a mention of complementary therapies, because a lot of my patients who come to see me are often on complementary therapies such as acupuncture or herbal treatment. Now look, that's fine, because most naturopaths or people who are doing this have your care and health as well at the forefront, and the overall thing is making you feeling well and your well-being. But don't forget, this is just complementary, and it's the traditional therapies that have been proven to work, and the key is to talk with both your practitioners. Now for you guys, your health is very important too. Your lifestyle can affect your fertility, and these things include a poor diet, smoking, recreational drugs like marijuana or cocaine. Certainly we know increased weight and having a sedentary lifestyle will also impact on your lifestyle. And guys, also steroid use will definitely impact on your fertility. And we know that men that take steroids while they're doing that will be sterile. The mechanism for all this, or the culprit, we think, is increased DNA fragmentation, which will affect your sperm. I'm often asked by people, about the frequency of ejaculation. How often should I be ejaculating? Should I be saving up? And many men do feel that if they ejaculate less and save up their sperm, it's far more potent when they do ejaculate. Well, in fact, that's actually not the case. And in fact, that could damage your sperm. And the ideal is for a man to ejaculate every 2 to 3 days for optimal sperm health. So some really good healthy tips, guys, for you would be to stop smoking, reduce your alcohol consumption. When I mean no binging, because alcohol certainly does impact on sperm, and binging is where you have more than 5 glasses in any one session. Try and be a healthy weight as well. And if you have any sort of chronic health conditions, very important to get this reviewed by your GP, because chronic health can impact on sperm as well. I want to talk a little bit about what are the natural chances of getting pregnant, because this is one of the most common questions I get from couples that come to see me. Well, the chances of conceiving are all based on female age, and if you're a woman who is 25 years of age, then the natural chance of getting pregnant is around about 20% per month. And this is all based on fecundity trials over many, many years. If you've been trying for 6 months, then your natural chance is about 60%, and this is described nicely in the graph next to you that shows you chances of conceiving over an 18-month period. By 12 months, you should have an 80% chance of conceiving naturally, and by 18 months, a 90% chance of conceiving naturally. Now this is for a couple where a woman would be about 25 years of age. Now if you're someone who's 35 years of age, then the chances do drop down to about 15% per month, and if you're 40 years of age, it drops down to 10% per month, and around 42 years of age, the natural chance of conception is 5% per month. So age for us women is extremely important. Now this diagram does show that you've got the greatest chance of conceiving within the first 12 months. And this is important because we know that a couple who have been trying to conceive for more than 2 years, if you've been trying for 2 years, then your chance drops from 20% per month down to 4% per month. And this is very serious then, and I would recommend you go and seek help and see a fertility specialist. Look, by the way, you're not alone. 1 in 6 couples actually will have trouble conceiving, and this has been shown all throughout the Western world. And you think, well, why doesn't it happen naturally, and why should it be that 1 in 6 couples need assistance conceiving? People who come to me say, look, we're healthy, we're doing everything right, what could be going wrong? Well, there are many causes for why it may be taking longer to conceive. This can be broken down to female-related causes, male-related causes, or a combination factor. And when we talk about female-related causes for difficulty conceiving, we're looking at situations like blocked tubes, perhaps infected tubes or endometriosis, or sometimes, you know, infrequent ovulation of the egg, and these will all be causal factors that are female related. Another big factor for women is age, and as I talked about before, female age is one of the biggest factors in reducing the chance of conceiving. Look, I want to talk about male-related factors because this is a very large area and men have a big input into why it may be taking longer to conceive. And we find that 30% of causal factor is male-related, and this is related to your sperm. And we're looking at reduced volume of sperm, reduced numbers of sperm, and reduced swimming of sperm, and often this needs to be investigated further. We find that 30% of reasons are a combination, and that means both couples are having some sort of factor-related fertility issues. And all of these three add up to about 90% reason of why couples take longer or might need assistance conceiving. That leaves 10% of couples who are trying to conceive and who are having trouble, and we then sort of, when we can't find a reason, it's kind of labelled unexplained infertility. There could be a reason, but we don't yet understand why. And so if you are having trouble conceiving, certainly I would be recommending seeking help. And certainly at IVF Australia, we have over 30 highly trained fertility specialists caring for our patients. And you can have a fertility specialist of your choice, you know, undertaking assessment, and it's very important if you've been trying for a while to really get assessment done to make sure that there's nothing going wrong with you. Now look, you may have heard that there are some new fertility clinics that have emerged lately, and just to let you know, these fertility clinics basically GP focused and GP run, which is a concern to me. So me, myself, and I know my colleagues are very focused on entirely on helping you achieve a pregnancy and to take home a baby. We work with a team, which I'll be talking about later, and this team includes scientists and senior fertility nurses as well as counsellors. So certainly we have a very large experience in our IVF program, Australia program. But as I said, it's very important if you've been trying for a while to go and get an assessment and see a fertility specialist. When you come and see your fertility specialist, this is what I do. So when couples come and see me, I will be going over your history. So we talk about your history and we discuss your situation and hopefully get some answers and eventually plan treatment for a pregnancy. And sometimes after assessment, you know, everything may be normal and you may go and achieve a pregnancy naturally. But certainly during the first consultation, the specialist will be organising, you know, investigation tests based on what your circumstances are and your medical and fertility history. And this is important because this will enable a plan to emerge and hopefully give you some much needed answers and information. So when couples come to me, what I do is that for her, I would be taking a medical and fertility history. I'll be organising for very special fertility blood tests to occur and looking at all the prenatal testing as well. I'll be organising a pelvic ultrasound where we check your ovaries and look at the uterus and perhaps even check the fallopian tubes. And most importantly, we'll be looking at your ovarian reserve, and this is a very special test for women. It's very new. It's called the AMH, or the anti-Mullerian hormone test, and some have even nicknamed it the egg timer test. And you think, well, what's the whole point of this? Well, the whole point of this is to really make sure and look at what eggs are within your ovary, and this diagram explains it beautifully. Now, for us women, age is extremely important, and from this diagram you'll see that we women are born with all our eggs, and so at about birth we have about 2 million eggs within our ovary. So you could call us a warehouse, really. We're born with these eggs and we use them up over time, and you can see that the curve reduces, and by the time we've reached puberty there are about 400,000 eggs left. So you can imagine as a little girl running around and swings and playing, that even as a child your eggs will be dying off over time and with some sort of timed cell death that we don't yet understand. And these eggs are depleting, and by the time you are wanting to conceive, which might be when you're 30, you'll have less eggs again. And so what this ovarian reserve test does, it gives us an idea as to an indirect way of the number of eggs you may have left in your ovary. Now for men, your assessment's very important too. When guys see me as a couple, I'll be going into your medical history and your fertility history. It's very important for the assessment to look at your sperm, and in the analysis of the sperm we have very high-tech andrology laboratory where we will be checking the volume, we'll be checking the numbers of your sperm, the swimming and the motility of it, looking at the appearance of it. We check the DNA within your sperm, we check for any infections as well. And this diagram just shows you samples taken by one man, as you can see, over 120 weeks, and you can see how variable sperm samples can be, which is why when we take a sample, if it's abnormal, we would always repeat it. So often you might have one or even maybe 2 or 3 samples assessed over a certain period. And you can see from the slide, on a good day he had almost 180 million sperm, and then on a bad day he had almost 0. So this also reflects from this one bloke and reflecting how lifestyle can affect your sperm as well. Once you've had these tests of my couples, they then have a follow-up consultation. And this is a very important meeting because we're gathering all the information from all your test results and sitting down and looking to see what the causal factors might be. Depending on the causal factors will then depend on what type of fertility treatment may be necessary. And some couples don't need fertility treatment at all, they just need reassurance, and that often they go on and conceive naturally. And some people may need to go on and plan for pregnancy with fertility treatment, but whatever treatment that couples may need to do, they can commence whenever they are ready. So if you are going to be undertaking treatment with us, you can commence that whenever you are ready. Just to let you know that our treatment at IVF Australia is extremely personalised. Your treatment plan is very dedicated and designed specifically for your own personal circumstances, and this will be in consultation with your consultant. Treatment doesn't necessarily mean starting, on an IVF cycle. In fact, a lot of my patients don't need IVF, and often we can use very simple treatments, and I want to discuss some of those treatments now with you. This is one treatment that we do have. It's called cycle tracking. And what's important about this treatment and what's the point of all this is that it will help pinpoint your most fertile time so that you've had sort of timed intercourse to try and increase your chances of conceiving. So it's very important that you know your cycle. It's important you know when your fertile window is, and many of you may already be doing this. You might be doing home ovulation tests or using the digital thermometer for basal body temperature, and they're all fine. However, what we do is far more accurate. It involves coming in for blood tests and scans, and we accurately monitor when you're ovulating and identifying the time of ovulation and when to have sex. Good thing about this is you leave your man at home. There's not too much effort involved, and the service is billed with us at IVF Australia. Why is it important to pinpoint your cycles? Well, if we can get an idea when you're ovulating, you can then go off and keep on trying on your own for a bit more. But look, if you're not conceiving after that, then we usually recommend coming back or seeing a specialist and looking at other options. And I want to discuss now some of the other simple options that we offer couples. And many of my patients require just this simple treatment. The first one is something called ovulation induction, and this is where we are inducing the eggs to grow or helping the ovary to release eggs. And this treatment is recommended for women who ovulate infrequently or may not ovulate at all, such as in the situation of polycystic ovarian syndrome. And one of the main treatments is a tablet called Clomid. It's a very simple treatment. It only costs about $35. Another ovulation induction treatment is the injectable fertility drug, FSH, and here we give you hormone injections to help make ovulation occur. Now this particular treatment is not rebatable by Medicare. It may cost around about $680. Another very nice and simple treatment is called intrauterine insemination, and it's here we track and monitor your cycle with blood tests and scans, and we know exactly when you are ovulating. We can sometimes even give you some very low dose hormones just to tweak your ovaries, and when we pinpoint your ovulation, we get your partner's sperm or donor sperm, and we can actually prepare that in our laboratory and do things to it that can help stimulate the sperm and increase the motility. We chuck out the duds and have good quality sperm, and we then inseminate that sperm through the neck of your womb into the uterus right at the time of ovulation. It's a very nice, simple treatment. It's ideal for couples who may be reasonably young, who have normal fallopian tubes and then the sperm is okay. And you're looking, it is rebatable, so Medicare does support this treatment, and you're looking at about $1,500 out of pocket with the Medicare rebate. But some couples may need advanced treatment, and often I need to take my ladies for surgery to help enhance their fertility, and this might require a laparoscopy, especially in cases where there might be endometriosis involved. Occasionally men might need to have surgery too. They may need to have some sort of surgical sperm collection where we get sperm from the testes. Other advanced treatments that we offer is in vitro fertilization, called IVF, and here we stimulate your ovary to grow eggs, and then the eggs are collected. We then fertilize them with sperm in the laboratory to create embryos, and then put embryos back into the uterus and hopefully have some spare ones for freezing. Intracytoplasmic sperm injection is IVF, but we're adding an extra step where we actually take the sperm and we inject it into the egg. We do this in situations where there may be male factor fertility with low sperm numbers. Now, some couples might even need to have the advanced treatment with their IVF called pre-implantation genetic diagnosis, PGD. This is an advanced treatment that we do at IVF Australia, where we actually can take the cells from the embryo and genetically test them for their chromosomes. And the benefit of this is that we can actually pick a healthy embryo to go back into your uterus. And so this is for couples who either may be having miscarriages, or maybe women are older, or in situations where they might be carrying an abnormal gene or chromosome. But it's certainly a very effective treatment. At IVF Australia, we have very advanced services, and if you're someone who has a complex fertility case, then you may need to have these further advanced services. And here we can actually select the best sperm with these services. We can try and select the best eggs and try and select the best embryos. You can see from the pictures here, our scientists are highly trained and been working in the area for years, and we have highly technical laboratories around the place, which I'll be talking about shortly. We also offer a very large donor program. We're very experienced in the donor program. So if you're a single woman, or if you're in a same-sex relationship, or a heterosexual couple who may have a complex fertility issue, then we certainly have a well-established donor program where you can access donor and help create your family. And just to put up these slides here to show you that there are many ways to create a family. You can see here's Jodie Foster with her two lovely sons, which she conceived through donor sperm, and of course there's our lovely Senator Wong and her partner, who's also conceived through donor sperm, and you can access a lot of this information from our website. Now, when it comes to fertility treatment, not only will you have like a fertility specialist such as me, you actually have what's called a patient care team, and this involves a senior nurse looking after you. It involves a counsellor looking after you. It involves admin staff and scientists looking after you, and it's really a whole team approach of our experts at IVF Australia. So we work as part of a team. It can be hard, not conceiving and going through fertility treatment can be a real emotional roller coaster, and so our team is here to help you, take you through step by step, make it nice and simple, and try and make that pathway to pregnancy a lot easier and less stressful for you. And looking at that, I wanted to put up the slide because this is my team. This is my team at Kogarah, and you can see the two nurses there is Marie and Deirdre, and Karen is the admin staff, and Nicole is our wonderful counsellor there, which we have counselling services for free for anyone undergoing fertility treatment. At the end of the day, our focus and my focus is on your success and helping you guys get pregnant and really having a healthy baby, and that is our focus. But you probably remember I talked about pregnancy chances before, and I want to show you the slide about what the success rate might be if you was undergoing an IVF treatment. And again, success rate for all fertility treatments is related to female age. So the younger you are, the more likely you are to conceive, and the older you are, the harder it might be, or you may be more treatment cycles may be required. And now looking at the slide, the green bars is the normal chances of conceiving naturally. The dark purple bars are the chances of conceiving by putting one embryo back into your uterus. We've put in what's called the live birth rate, so your take-home baby rate based on your age after having one embryo. And it's because, you know, miscarriage can still occur, and the miscarriage rate or the risk of miscarriage with IVF is no different to the risk of miscarriage with natural conception. But looking at the slide, you can see that women who are under 30, their normal chance of conceiving is 20%, and with IVF, you're looking at a 50% chance of conceiving. So it's increasing at 2.5-fold, and going right down to the other spectrum as women get older. When you're over 40, chances are a little bit more difficult for conceiving, and if you're around 43, the chance of naturally conceiving would be in the order of about 2% per month. Conceiving with IVF, with that embryo going back, you're looking at about an 18% chance of conceiving. But this is just to give you an overall view, based on age, what success rates are like. I want to show you this. These are all our specialists here at IVF Australia in Sydney and Outer Sydney. Most of our fertility specialists, we're all gynecologists and obstetricians. So we've spent, you know, I've spent 15 years becoming an obstetrician, and then many of us, including me, have spent a further 3 years undergoing fertility training for what's called reproductive medicine and CREI. And this is very important because you're getting all our minds together in a group experience helping you conceive. We're the largest group of fertility specialists in Australia, managing care. And you can see from the map that our clinics are all the way up in the Hunter through to Gosford, around Sydney, and also down in Wollongong. And the idea is we have these different monitoring clinics and patient clinics, so that it makes it easier for you to go and see a specialist and have your treatment depending on where you're living and depending on where you're working. The idea is to make it much easier for you. So I hope I've explained a little bit about what's important for preparing for fertility and pregnancy, what the natural chances are of getting pregnant, what some of the fertility options are as well, and a little bit about us. And I'm going to hand you back to Jenny now.
Okay, thanks, Raewyn. Well, I'm now going to bring you back to our faces so you can see us as opposed to the presentation. So just bear with me a minute here. There we go. Coming up shortly, will be on your screens. There we go. Okay, thanks very much, Raewyn. Now, look, we'll come to the question time now, and fortunately you've ordered some questions in advance, but if you wanted to type in some questions now for us, go ahead and do that. There's a spot on your screen where it's highlighted, so you can start typing, and hopefully we'll get to those questions before the end of the night, if time permits. But we've got some questions here, Raewyn, you might be able to address. One question is, how long should we as a couple keep trying naturally before we seek help?
Good question, Jenny. How long should you be trying? Well, it's recommended that if you're a couple where you're under the age of 35, then you should be trying for at least 12 months or up to 12 months before seeking help. If you're a couple who are over the age of 35, and if you've been trying for longer than 6 months, then yes, then you should be seeking help. Again, it's all related to female age, and what we don't want is we don't want couples trying and trying and trying, and then female age factor becomes a cause.
Lovely. And another one is, how long does the whole process take for fertility treatment?
I suppose it depends what you're having. In terms of the process, in terms of seeing a fertility specialist, well, to get in to see a fertility specialist, it may be 1 or 2 weeks. so it's not a long wait. When you see the specialist, you'll be having tests, or they may need to organise tests. And by the way, if you have had tests, take them along with you for your fertility specialist to see. But if you need tests, doing those tests and getting follow-up may take another 3 or 4 weeks. And so by then, sitting down and, if you need treatment, working out a plan, a fertility treatment cycle is usually about a month in total. So you might be looking at about 2 months. Yeah, looking at about 2 months in the whole process, from seeing a specialist all the way through to finishing treatment and hopefully, being pregnant.
Lovely, thank you. And another question is, we've got some donor people out in the audience, so welcome to you. How does IVF work for same-sex couples?
Yep. Well, we offer IVF for same-sex couples, and we have a large donor program. And so, if you need donor sperm, then you would need to see one of our fertility specialists to discuss that further, to get donor sperm. Some of you may even have a friend who may want to donate sperm, and of course you would come along and see this fertility specialist and get your friend involved, and we would do all the workup for you with your friend. And it's just really like a normal IVF process. We would still consult you, we would look at your fertility and medical history, we would still do all the tests as for everyone, checking your AMH and looking at your ovaries and looking at your uterus. And then with IVF, we want to make sure everything's fine before starting an IVF cycle. And then we would commence with a period, and then you're looking at about 2 weeks of fertility injections for an IVF process, taking out the eggs and then fertilising it with the donor sperm, and then creating embryos and putting it back into your uterus. And so we have a large donor program. When it comes to IVF or any fertility treatment with donor sperm, you would need to see our counsellors. But we have a set program to help you and make it easier for you. Each clinic has a dedicated donor nurse to make it easier for you as well, and so the whole process can be quicker. Can you add anything more, Jen?
Yes, no, that's right. I mean, I just wanted to reinforce that we have a very solid, experienced donor team, and we, they're dedicated to the same dedication that the IVF specialists are as well, to help you fall pregnant and make this journey as well as possible.
Okay.
Okay.
Yeah.
So we've got some more questions here. Another one is, what can be done about hostile mucus or low-quality eggs?
Yes.
We have been trying for 18 months. My wife has regular cycles. We've had lots of tests done through IVF Australia. All looks good. We have been diagnosed with unexplained infertility, so we're not sure what is holding us back.
All right.
That's a good question.
Okay.
Good question.
Yeah, it is a good question. But also it depends on, obviously, age of your partner as well. In terms of if you're trying for a while, unexplained infertility is often the most frustrating of all, not finding a reason. In terms of hostile mucus, that was always tested for years and years and years. We no longer often test that, and many of us don't test that anymore because studies have shown that doing testing is just stressful and it doesn't change management. To try and overcome hostile mucus, intrauterine insemination is one treatment option. Otherwise, if you've been trying for a long time, then I would certainly, and you're over the age of 35 or 36, I would even be thinking about moving towards IVF. Now, when it comes, you mentioned, was it Jenny mentioned about egg quality? I assume that you've had the AMH test and it's low. Now, if it is low, I think I'd get cracking. I would, and look at something more advanced in fertility treatment like IVF or IVF and Dixie. I hope that's answered your question.
You sometimes have to come in and get the full story, don't you?
Yes, yes.
And make a thorough consultation.
Well, you're obviously must be seeing someone at IVF Australia, and no doubt you'll be getting the appropriate advice, and I would probably go back and see your fertility specialist with some of those concerns, or and look at a treatment plan for you. And
we've got a final question here, Raewyn. It's an interesting one. Can a circumcision gone wrong affect a male's fertility?
Yes and no. I suppose it depends on how wrong it's gone. Because you can have a situation, one it was very painful. So I've had situations where men have come to me and it's been extremely painful. to ejaculate, and so they're less likely to ejaculate. Yes, sometimes you can have reduced volume. It shouldn't have any effect on motility, okay, so won't have any effect on the swimming of the sperm, and it shouldn't have any effect on the appearance of the sperm, and it shouldn't have any effect on the function of your sperm, but it may have an effect on the volume of sperm coming out, and the simplest way to truly check that would be to go and do a semen analysis, okay, and check your volume and all those semen factors.
Yes.
Yeah.
Good.
Yeah.
Okay, and is there? Yes, we have another question here.
Yep.
What are the? Yeah, sorry.
Yeah. So,
go ahead.
What are the success rates? We had a question. What are the success rates of ovulation induction? Well, it depends on what your cause is for needing ovulation induction. If you've got polycystic ovarian syndrome and you're reasonably young and tubes are fine and sperm's fine, then the success rate's actually very good. If you take clomiphene for ovulation induction, then the chance of ovulating is around about 80%. So when I give my woman Clomid, I tell them that they have an 80% chance of ovulating on that cycle, and if they have sex, you know, at the time of ovulation, then of course it's a 20% chance. There's a group of women that, you know, 20% of them that won't ovulate on Clomid. And may require higher doses, but studies have shown that PCOS women that undergo Clomid treatment, something like 60% will conceive within the first sort of 8 months, which is actually quite high. So I think it's a great treatment. When it comes to FSH or injections for ovulation induction, that is certainly very successful as well and has similar rates. The problem with ovulation induction with injections is there's a high multiple pregnancy rate. So if you undergo that treatment, which I forgot to mention actually, there is a chance of a twin pregnancy. But no, I think the success rate's great. It depends on the reason. If you're a couple who have unexplained infertility, so you're ovulating regularly, then the chances won't be any different to the 20% per month. Okay. So it's designed for women who don't ovulate frequently. All right. Hope I've answered that.
Okay. Lovely.
Yeah.
All right. Well, I think that's all we have time for tonight. So I want to thank you all for joining us. And I wanted to also say that I will be in touch with you within the next 24 hours to see if there's anything further we can help you with. I'm on the 1-800 number along with my colleague Sarah, and we can answer your questions and direct you in the right direction, we hope. Now, also I wanted to also reinforce that tonight is a special offer because you've joined us tonight, that IVF Australia can offer a bulk billed for initial consultation with a fertility specialist just because you've joined us tonight. So if you'd like to take up that offer, of course you'd need a GP referral to bring with you, but I can help organise that as well. Also, for those that are in the remote areas, we can also gladly say that we could offer you a phone consultation with bulk billing attached to that as well. So I'll be in touch with you, and I think that's all from us tonight, and we wish you a pleasant evening, and thanks for joining us.
Yeah, thank you very much, and good luck everyone. Okay.
Yes, good luck with your journeys. Thank you. I'm just going to sign us out now. Goodbye.